All right, thank you, Ron. Okay, our next presentation, the Keith Christensen. He's from Utah State University. He's also one of our Western Michigan University's TRCRC partner. And then he's talking about the relationship between transportation and elderly individuals' access to community health services. Let's welcome. Okay.
Okay, well, thank you. I'll try and go quickly and keep us on track. So I'm going to basically, first I'm going to talk about the intersection between disability and individuals who are elderly or older adults. And doing that really is, I'm coming from the Center for Persons with Disabilities at Utah State and collaborating with the Transportation Center. And we're looking at and spending a lot of time at this intersection between disability and older adults and the elderly. The link between those two and really the impact of it. And to do that, there's some stigma attached with this idea of being an individual with disability. And we heard a little bit earlier in the keynote address earlier that there's also, although it wasn't, that there's some stigma also attached with this idea that you are elderly. And that there's a lot of people that don't want to be considered elderly. And unfortunately, I've reached the point in time in my life actually where I take my 4-year-old to the playground and everyone congratulates me on bringing my grandchild to the playground. So I feel this a little bit. But there's also a lot of stigma attached with this idea of being an individual with a disability. But disability needs to be understood a little bit differently in that disability is just a natural part of the experience or the human experience, and that it basically has it doesn't diminish our rights to participate in society in any way. And this is really considered to be the social model of disability if you look at it in this way. And I find it helpful actually to really talk about disability and understand it as an experience. When you understand disability as an experience, there's a functional continuum that we use, and everyone falls along this continuum or spectrum somewhere. Everyone has particular functional competencies, and they change. On the left-hand side, your abilities, they'll go up and go down depending on various factors: injury, illness, age. Will change these abilities or functional competencies. But every environment sets demands in order for participation or use of that environment or product or service, whatever it happens to be. So there's always this intersection or this alignment between the demands of the environment and the functional competency of the individual or those abilities. And whenever the demand of the environment is actually higher than the competency of the individual, that experience for that individual is what a disability is. Disability is not a condition of a person. It's an experience. Disability is an experience that comes from this misalignment of the demands of the environment and the competency of the individual. And we see that if you look at disability in this way, it changes basically who we would consider to be individuals with a disability, because we all are. And we can all basically have this experience in the environments that we find ourselves in. And in particular, as the disability community looks at this, the approach then is basically to look at the environment and the demands that are being placed on individuals by the environment. And that's really where we address disability, because these variations in people are natural. It just happens. So we focus our time on the environment to address disability. Elderly individuals, we find as you get older, the functional competencies may lower somewhat. And you may find that you move from a situation where your competencies were greater than the demands of the environment and you were not experiencing disability. But as you get older, these competencies may lower, and all of a sudden you begin to experience disability. And if you ask, and it's very common if you ask older individuals whether or not they consider themselves to be or to have a disability, they will tell you that they do not have a disability, they're just old. But frankly, what it is, it's a disability experience, and they are now experiencing that. And it's broad range, so an elderly individual without access to an automobile essentially would have a mobility impairment in an auto-oriented environment such as stereotypical suburban sprawl. So all of a sudden they begin experiencing what you would normally consider to be an individual with a disability, what they have been experiencing all along. And we talk about, and it was shared earlier about this silver tsunami. In the disability community, there have been a few historic events which have resulted in great change to improve the quality of life for individuals with disabilities, who tend to be a disenfranchised group. One of those basically, as we've gone through different conflicts and wars, and we've had veterans return, we've had individuals who have acquired impairments in these conflicts, and our society's addressing those is basically, it has improved the quality of life for individuals with disabilities, because these individuals, as we've addressed them, we've addressed all individuals with disabilities. Civil rights movement was another one of those, the co-movement of the disability rights movement that basically springboarded off of that. But the disability community is looking very carefully and with some they're looking very positively at basically the aging of society, because as these individuals who have not been disenfranchised to this point in time begin experiencing disability, the changes that will occur will then improve the quality of life for all individuals with disabilities. Disability community, if you look at this, they recognize 4 primary barriers in the environment which contribute to disability disparities: employment, housing, access to services, and transportation. And I just think that's a great picture, so I put it in everything, even if it's not appropriate. But transportation. And transportation is increasingly seen as a critical factor in community integration and participation. Transportation is fundamental for individuals' need to engage with their community for employment, goods and services, health, education, socializing. With individuals with increased access to transportation reporting greater quality of life and lower levels of social isolation, and greater health and well-being. And these transportation systems then are very important to individuals, because transportation establishes the conditions of possibility for how people are able to live in place or age in place. Access to transportation. Very important, and one of the critical factors that is looked at. So again, the demands of the environment, these transportation demands become very important for all individuals. And we take this for individuals who are aging, and this is data that you're probably very aware of, but that as we're young and we take a functional competency or functional limitation approach, individuals who are younger, they recognize fewer. We're not talking about disability here, but just functional limitations. And then they increase as we become older. And they increase quite significantly as we become older. And what happens is so many more people now experience disability, particularly in transportation, as they have less access to what they've had before because of the gap between the demands of the environment and their ability to meet those demands. If we look at the percentage, and this is census data, percentage of the country, basically, with populations age 65 or older, who identify as having a disability. I like this data because if you were to ask these individuals whether or not they have a disability, they would likely tell you no. However, census basically identifies disability not by saying, are you disabled? They will ask a number of questions such as, do you have difficulty in walking or climbing? And the indication of yes, having difficulty in that basically would place you in a disability category. And 39% of people age 65 or older have at least one disability, according to these questions. Of those, 2/3 of them say that they have difficulty in walking. Interestingly enough, the second most cited disability, according to the census questions, is difficulty with independent living. And the question is worded saying, do you have any difficulty with independent living, such as visiting a doctor's office or a few other places? And it's really an indication of that and the impact on health care. Transportation is a basic but necessary step for ongoing health care and medication access, particularly for those with chronic diseases and other issues. Chronic disease care requires clinician visits, medication access, changes to treatment plans in order to provide evidence-based care. However, without transportation, delays in clinical interventions result, and we have an increase or a worsening of conditions, an increase in comorbidities, exacerbations, and basically worsened health outcomes. So the purpose of the studies which we're involved in really is examining the elderly individual's access to transportation and its relationship with these community health care. And it's a variety of studies in that we're conducting studies looking at individuals with disabilities, but often individuals who are identified as having disability are also older. So in one particular studies we've looked at it, this was a survey basically in Cache County, Utah. The comparison in the bottom graph. For the study population of individuals with disabilities, these are older individuals, 65 or older with disabilities. And some comparison. If we just look at the national population of the individuals without disabilities, you'll see the broadest is, private vehicle use, followed by some of these other modes of transportation. If we look at individuals with disabilities on a national level, you still see private vehicle use is pretty high, followed by an increase in riding with other people and bus use and paratransit and some of these other modes. But for older populations of individuals with disabilities 65 or older, private vehicle use is very small in comparison, much smaller. Riding with others is larger. And this would be with family or friends or other individuals that will take you someplace. Bus use increases quite dramatically. And in our study area in Cache County, there's a free transportation system, transit system of bus use. Paratransit, this is actually an interesting one because it doesn't often tend to be paratransit. It can be buses that are dedicated to assisted living facilities or something that's considered basically paratransit by this population, even though technically it's not necessarily paratransit, but it's used in that way. And then some of these other modes that you can see, but there's a big change which we've been able to identify for individuals who are older. Then looking at basically travel time for individuals who are elderly with a disability, and just the amount of time that it takes to make certain trips, over half an hour to get where they need to go, depending on basically the discrepancy between not being older and making these trips. And then comparison with some of the private vehicle use, where you can see it takes quite a bit of time actually for an elderly individual with a disability to access the community. Survey also asked respondents how often they missed or delayed a healthcare trip because they could not drive or did not have a ride. And previous studies have basically indicated that we don't have a lot of data on this, that not as much is known not as much is known about how many healthcare trips are missed due to a lack specifically of transportation. For our comparison group, the most common reasons respondents reported not being able to get to or reach a desired healthcare destination, basically in a month, is 1 to 2 times, 32% of the population indicated that they couldn't make a healthcare visit during that month because of lack of transportation. 3 to 5 times, there was another 30%. This is actually a burden even on the healthcare system because you have individuals missing appointments and missing opportunities. So it's kind of a double whammy kind of thing. Whereas there was only about 10% of the population that said they had no difficulty in accessing healthcare due to transportation. When we talk about transportation, though, the reasons for not reaching a destination included weather as being a transportation factor. About 23% of the time, it was weather related for transportation. They weren't going to, we get a lot of snow and they're not going to drive when there's snow. Sometimes driving when there's snow is easier, you just slide right there. So, but inadequate public transportation, 17% of the time. Lack of access to public transportation was just 6% of the time. But then lack of specialized transportation, being accessible or door-to-door types of services, 10, 11, 12% of the time. So I actually have some interesting things that we'd found, some anecdotal data. Individuals with fewer options for private transportation are less able to access their necessary healthcare services, which contribute to increased comorbidities. And often the healthcare trips that they are making would tend to be by ambulance. And there is we were finding some evidence that because they're not able to access transportation, they're calling ambulances to get them to places, even though they don't actually require the emergency medical services. But they'll use basically an ambulance like a very expensive taxi sometimes. So, and then lastly, we were looking at whether or not individuals who are elderly with disabilities are meeting their transportation needs using their social networks. And so we were looking at friends and family and whether and how that was meeting their needs for healthcare access. And it's very important because often medical care tends to be kind of a private thing, and so we're looking more towards friends and family. But family were correlated with access to, with transportation access to healthcare, as were friends. And these correlations were directly tied to individuals with elderly individuals' disabilities accessing transportation through their family and friend networks in order to meet their health care or acquire health care. And stronger social ties are correlated with fewer missed appointments. So the more family, closer friends, fewer missed appointments. So and often the elderly may depend on their social networks to mitigate the barriers in the transportation system access for health care, resulting in increased demand on elderly individuals' already limited social networks. And I believe I am out of time, so I will leave it there, which is good because it was the last slide.